Welcome to the Global Addiction Therapeutics Innovation Day.
Good morning, everyone. I am Atul, one of the co-chairs of this session. It was really astonishing to note from Anya's presentation that the WHO product profile or the pre-qualification has never been utilized for the treatment of substance use disorders, something like a food for thought for all of us in the academia as well as from the industry side. So I'm very pleased to now invite our next speaker, Sanita Suhartono, who is from UNODC. She works with the PTR, the Prevention, Treatment and Rehabilitation Section of UNODC. She is going to talk about the application of digital health tools in the area of substance use disorder management. Sunita, yes, the floor is yours. 15 minutes.
Thank you so much also to the organizers for inviting UNODC. So I've been working the past almost 10 years with Anya together before she left us to to WHO. As mentioned, I will be speaking about the digital applications to support people who use drugs and those with drug use disorders. I would like to start by giving you a overview on the global situation on drug use and drug use disorders based on the World Drug Report that was published last year. And also just to note, in a month's time, we will also publish this year's World Drug Report. So we know that in 2022, about 290 million people have used some type of drugs, with cannabis being the most commonly consumed worldwide, as you can see on the graphic. And about 64 million people are living with drug use disorders. And as Anya already mentioned, unfortunately, only 1 in 11 people are receiving treatment globally. The services or the situation is also worse for people in vulnerable situations, such as women. You can see only 1 in 18 globally of women have received treatment, and the situation is also worse in the criminal justice system, like in prison, in rural settings, but also in humanitarian settings. And what we know about access to treatment is that we don't really know about the quality, right? So I just wanted to highlight here that quality in treatment and care is important, and that people with drug use disorders receive the same care as for people with other health conditions. In terms of UN innovation strategies, I would like to walk you through to the different international frameworks. Based or led by our Secretary General Antonio Guterres, in 2018, the UN published an innovation strategy that defines how the UN system can support the use of new technologies, including artificial intelligence. And I have also highlighted, obviously, the strategy of new technologies is in line with the Sustainable Development Goals. And the UN strategy is also being used for the UN 2.0 vision, which is also an advocacy approach for UN staff within the UN system. There is this UN innovation network, and I just wanted to highlight maybe relevant for this audience that there is also a topic on behavioral science. If the UN staff so wishes to learn more about innovations in behavioral science, there is a platform for this. The first UN resolution on artificial intelligence was adopted last year in March, and here I just wanted to highlight, and this will lead to the Pact of the Future. So later that year, based on the AI resolution, also the resolution on the Pact for the Future was adopted. And I would like to highlight here 2 action points that are relevant for our work. So to ensure that science, technology, and innovation can contribute to eradicate poverty, but also to ensure equitable access to essential services for children, people, and especially also in health. And here, what is nice, mental health was highlighted as well. I just wanted to highlight, since I'm working with UNODC, that last year also the Cybercrime Convention was adopted, and this is an approach to prevent the global problem of cybercrime. So if you think about the use of AI, obviously there are a lot of safety concerns, and UNODC is the custodian as well as the secretariat of an ad hoc committee that looks at the comprehensive international conventions on countering the use of false information and communication technologies for criminal purposes. And now I'm already walking you through the innovation approaches for drug prevention and treatment based on the international standards. So starting with the international standards on drug use prevention, web-based or online interventions was or is highlighted mainly in school-based or workplace prevention, such as early intervention, providing brief interventions, counseling, and referral to treatment if needed. And I would also like to inform you that in August last year, UNODC conducted a technical consultation with big companies such as Meta, X, on the use of social media on prevention of drug use, and the report will be published soon. Moving over to the international standards for the treatment of drug use disorders, the use of internet is highlighted in sharing information and the availability of accessibility of treatment services, but also the use of web-based or telecommunication services, especially in rural areas or remote areas that lack specialized treatment services. I would also like to highlight the Commission on Narcotic Drugs resolution that mentions innovative approaches, which was adopted in 2021, that mentions the development of new and innovative approaches to drug prevention and treatment, and encourages also the implementation of innovative drug treatment and recovery delivery systems. With this, also the General Assembly adopted a resolution underscoring technological innovation in addressing drug problems. So you can see here in the framework of COVID-19, remote consultations for drug treatment services, telemedicine, and greater flexibility in the provision of delivery of medication was highlighted. And with this, I would just like to share some of our experiences in developing and also guiding member states of developing digital applications for drug prevention and treatment. Starting with the example in Jordan, where we work together with the university and with outreach workers for refugees in a Zatari camp in the midst of COVID-19. We have developed this app that provides information for parents on parenting skills in the midst of COVID-19, but also in the humanitarian setting, and that reminds parents of vaccination appointments for the children and provides a vaccination history as well. Moving over to another example in Tanzania, where we work together with the Ministry of Health and the University of Muhimbili in developing this app, which was then used as a registry of available services in a rural setting of treatment for people with drug use disorders, but also whoever was interested in learning more about drug use and drug use disorder treatment. We had some information leaflets that could be accessed as well. And importantly, also because it was such a rural area, we have worked together with the Muhimbili University on a feasibility study, whether people have even access to phones, whether, how the mobile application was also perceived, and that has been published in the PLOS Digital Health as well. And the last app where we have supported another member state was in Indonesia, This app highlighted the link between treatment seekers and also rehabilitation services. So it's not only for people who are interested in seeking treatment, but also for the general public, let's say family members who are concerned about their own family members having maybe risk of drug use. And I think the interesting part is also that this app provided a directory of aftercare services. And similar to the Huru app, we have also worked with the Atmajaya University, where we looked at the feasibility of setting up the app. And most of the respondents have also highlighted that there is a high demand for teleconsultation applications within the app, since the app was developed during COVID-19. I just wanted to highlight a bit of collecting data. Together with South Africa and the University of Cape Town, they have adapted WHO's tool Assist on screening of alcohol, smoking, and substance involvement on an online website, so to say. And there are two login options. Either as someone who wants to self-screen, whether, let's say, me, I have a harmful pattern of substance use, or a practitioner. And this application, so to say, was then also applied together with other sectors like universities, higher institutions of like colleges, but also with the social crime prevention part of the country, where they have worked with people in prisons. I would like to highlight also UNODC's drugs monitoring platform, which is entirely online. So this platform was initially developed for real-time data on drug trafficking trends. But together with WHO, we have also applied the Substance Use Disorder Treatment Facility Survey on that platform. So countries can provide their assessment, so to say, for treatment services capacity live, and the data will be collected automatically. And recently, we have also worked with the criminal justice system and social system of some countries, where we wanted to create referral pathways to treatment as an alternative for people in contact with the criminal justice system. So just to mention, the facility survey is a suggested monitoring package, part of the standards and the quality assurance tools that UNODC has. And lastly, I just wanted to highlight as well that UNODC has a learning and innovation unit, where we work together in developing self-paced e-learning courses. And these are just 3 examples, and we have, I think, published them now in 2021, where we almost have 1,000 users already finishing the course. And just wanted to highlight also, in some countries they have applied some of the courses with their own videos, some included role plays. Lessons learned that I wanted to highlight from all of the process. So we have acknowledged the digital divide, not only in low and middle income countries not having access to mobile phones, but maybe also in the elderly population. With the application of digital tools, we could reach different settings. However, the preferred intervention is having it combined with face-to-face interventions. It's important to be flexible and adaptive, so to say. It's important to look at the data security and privacy, especially when you work with low and middle income countries that have different legal situations. Also important to look at sustainability. All of these apps cost a lot. This needs to be taken into account as well. And the need to strengthen evaluation, whether these digital applications are safe and effective. And another lessons learned that we have is when we try to kind of feed AI with our standards, so to say, so that they speak, let's say, the evidence-based language. However, I think it's still needed to have some guidance for whoever uses that AI later on like then providing recommendations on the treatment interventions. And yeah, but lastly, I wanted to highlight that we could strengthen our collaboration with academia, civil society, law enforcement, criminal justice, and social sectors from this experience. With this, I would like to thank you, and if you have any questions, I'm here. Thank you.
Organized by International Society of Addiction Medicine, sponsors and co-organizers, CNRE, Indivir, Spark Biomedical, Salofa, Ethifarm, University of Minnesota, European Union Drugs Agency, UK Office for Life Sciences,